Welcome back to the American College of Surgeons Bulletin Brief from the front line, Surgeons' Voices. With me today is the president of the Royal College of Surgeons of Edinburgh, Professor Mike Griffin. Good afternoon, Mike.
Good afternoon, Steve. Delighted to be here.
Good to chat with you. I wish it was in person, but we're into year 2 of these virtual meetings, so we take what we can get.
Yeah, and I just heard that the American College meeting it has been made virtual in October as well.
Sadly, but unfortunately, precautionary as well. The situation just keeps being in flux, and every time we think things are getting better, somewhere in the world they don't. And like the college in Edinburgh, the ACS is also a very international organization, and we have to have a global impact. And in fact, that's what I wanted to chat with you about today a bit.
Well, what is interesting, Steve, is that just last week we had our first face-to-face meeting in the college for 15 months. And this was working with the Australasian College. They had their meeting last week, and we were due to have a joint meeting with them. As you correctly said, we are very much not just a UK college, but an international college. And so we had a joint meeting, and we had a hub in the Edinburgh College, which worked really quite nicely. So we had we weren't allowed more than 50 surgeons in the room for social distancing reasons, approved by Scottish government, but it was quite a euphoric affair because everybody, 50 people were together, and it was lovely, and it worked very well despite the time difference.
Yeah, and 50 people could work, and I'm cautiously optimistic that maybe there will be some in-person meetings, although not the educational content during the ACS, but just maybe somehow, perhaps some committees or editorial boards. There are many allied societies that also have meetings during the college, SAGES and SSAT and ASCRS and others. So perhaps those things might miraculously go on, but I guess the challenge is 15,000 instead of 50 people.
Yeah, absolutely.
Trying to have the crystal ball polished up and buffed to look 5 months in the future.
Well, I was looking forward to it because I was getting the honorary fellowship of the American College of Surgeons. And so I was really looking forward to being there in Washington. But anyway, if they allow me, I'll be there.
Well, regardless, you'll still be getting it. So I guess I can be the first person from the Board of Regents to officially congratulate you on that well-deserved honor. And for those who don't know, in fact, why don't I let you describe, because I've been to the college, though, before you redecorated it. Nonetheless, the age of the institution hasn't changed, and we've just had our centenary, but just why don't we digress a moment and talk about the history of the college in Edinburgh, because it is quite impressive.
Well, it is the oldest Royal College in the world, 516 years now. The quincentenary was in 2005, and we have just sadly lost our patron of the college of 66 years, which was the Prince Philip, Duke of Edinburgh. And he was there at the 450th anniversary and the 500th. And what was lovely about that was that on the 450th, when he got his honorary fellowship, he was given a silver bleeding cup, one of the old barber surgeons' bleeding cups. And when he came back for the quincentenary in 2005, I remember it only too well, because he came up onto the stage in his beautiful light blue robes that we have at the Edinburgh College. And he was clutching a plastic bag, which was a John Lewis plastic bag. I don't know whether you're familiar with John Lewis in the UK, but this was a John Lewis plastic bag. And inside was the bleeding cup that we'd given him 50 years previously. So he had treasured it and brought it back on the occasion of the 500th. So it was very nice. So yes, it's a very old college, the oldest, and the biggest, actually, in terms of the Royal Colleges. We have over 30,000 members and fellows worldwide, and we do have a big commitment to internationality. and we have members and fellows in over 120 countries, and particularly strong in India, in Pakistan, in Myanmar, in Malaysia, in Thailand, and obviously in Hong Kong and Singapore. We have quite a focus as well, a bit like the Irish College with CASEXA in sub-Saharan Africa. And so, yes, very much an international college, and we've had to consider our international fellowship and membership very carefully during the last 15 months.
It's indeed a remarkable history of 1505, and I remember visiting and looking around the room where you hold the dinners, and I had prepared some remarks on behalf of the guests who, if memory serves correct, was myself and Robin McLeod. I don't remember who else. Yep. It was something like ad eundem or ad hominem fellowship, and had my remarks prepared and became almost speechless looking around and realizing that these folks from almost 500 years back at that point, had all been there in this college. It's a truly remarkable history. The only place I've seen so many of these bleeding cups, by the way, was in the Royal College of Barbers, which used to be Barbers and Surgeons near the Barbican in London. I don't know if you.
That's right.
And a few of the Royal College Surgeons of England's presidents, when you look at the mantle, because I think it goes back to 1340 or thereabouts, but a couple of the recent college presidents had been presidents of the Barbers as well. It's interesting. There's still some shared history. It's interesting to see that. But they had the whole collection of those bowls. But the fact that your patron, your royal patron, had it for 50 years, that didn't have it in a velvet bag, but instead in the John Lewis plastic bag, is a great story.
That's what he returned with. He also quite amusingly said that when he was made an honorary fellow, that he'd heard that James IV of Scotland, who gave us our royal seal in 1505, he had said that he knew that James IV used to pay his subjects to allow him to operate on them, particularly taking teeth out and doing dental surgery. And so when he'd heard about this, he thought, well, seeing his forebear did this, he thought he might start, now he was an honorary fellow of the Royal College of Surgeons of Edinburgh, to practice on his family. But I'm delighted to say, I think he did. It was one of his jokes and amusing asides, because I don't think he actually ever did.
No, I shouldn't think so. And the times have changed just slightly in 500 years.
Absolutely.
But, so not only is the history of the college rich from 1505, but the scope of the college, as you mentioned, beyond the Commonwealth countries and some of the sub-Saharan countries. So we worry about, as we spoke about at the very beginning, having in-person meetings, whether in Edinburgh or in Washington, D.C. or Chicago with the American College. How have you been managing in these last 15 months with all of your various exams that are traditionally given throughout the year, examiners flying to Asia and such, diplomats coming for ceremonies? How's that been working?
Well, the OSCE examiner, the MRCS exams have been paused internationally. We've been able to run our domestic exams almost without a hitch, and we've managed them face to face. We have looked at running some of the exams online. It is not the practices that we've had have been not helpful and not reassuring. There are risks of security and so on. And so we have maintained our domestic exams exclusively, and we are almost up to date. As I speak, there's the cardiothoracic exam for the FRCS going on campus here at the college. So we are back and functioning in that respect, but abroad it has been different, and the MRCS has been paused and the international MRCS has not been run. Again, because the online offering is just not secure enough and it's not safe enough. So we have continued to run joint surgical fellowship exams in Singapore and in Hong Kong. We've done that and provided the quality assurance remotely. And that has been very straightforward to do. We've had superb links and we have provided that quality assurance on a remote basis, but based here at the college, so that we have so many Edinburgh fellows who are in Singapore and Hong Kong, who have been our examiners both in Singapore, Hong Kong, Malaysia, and in Edinburgh and in the UK. And so we have been able to rely on those examiners to continue to do the face-to-face examining whilst we provided the quality assurance, the observing and the psychometrics. So some international exams have continued, but not the international MRCS, because that is an OSCE exam and we have not been able to run that yet. But we are still working on trying to make that a reality.
How are you going to be able to manage the backlog? I mean, one should think that given this hiatus and the sheer numbers you're talking about, I mean, in a typical year, how many MRCS exams would you run, just as background?
So actual exam, separate diets of the exam, we probably run about 20.
And how many candidates per exam?
So, well, it depends on the country. In Myanmar, it could be up to 60 or 70 each diet. Over 100 in Chennai, places like that. So a significant number of candidates that we have to make up. And what we have done is we have continued to support them educationally through a really fabulous webinar program that we're very proud of at the Edinburgh College. We started it immediately back in very early, late February, early March 2020. And we have run up to 4 or 5 webinars a week for a variety of groups, whether it be medical students, surgical medical students, whether it be surgeons in training and core surgical training, or whether it's the more senior trainees and the subspecialties and the specialties. But we've also targeted particularly our international fellowship membership and those waiting for the membership. And so we've provided educational offerings, certainly on a fortnightly basis, to the focused on the international membership.
Okay, so it sounds like you've got your contingency plan kicked off almost immediately with the educational series, and I've actually heard about it and been a bit of a part of it, and it's an impressive program indeed. And now to make up for lost exams, what do you see going forward? I mean, eventually the pandemic's going to subside to the level that we can get back to doing more things in person, or which of the elements that you picked up in remote sense will you retain, either for the ongoing education or for any exam processes?
I mean, we don't see a solution to the MRCS internationally at the moment, because the main places are India and Pakistan. And I don't need to tell you, Steve, that the pandemic is dreadful in India at the moment, and there's no sign of that improving over the coming weeks. And so we have no plans to be visiting India to run the MRCS. We had got plans to have extra diets so that we could get through the backlog and spend time in a number of cities in India, but that is just not going to happen. Those waiting in Myanmar are a problem for another reason, Steve, you know that. And there's unrest there, as well as coping with COVID. Deeply, deeply disturbing and very worrying times for our doctors who are waiting to be assessed. So at the moment, we have no plans this year of international MRCS examinations. We're working on the online offering, but progress is slow. And I do know that quite a number of different colleges have attempted online OSCE exams with very, very poor outcomes, I may say. So we're just continuing to work on it. I do hope that the whole platform improves, but at the moment we are just hoping that the pandemic does subside and we are able to travel.
Well, when you're not traveling, one of many advantages you may have at the college in Edinburgh is you're in a small country. I mean, it's not like the ACS in terms of geographic scope and population size. And then a major advantage you have over us is the Scottish NHS. So you've got data from the Scottish NHS that are captured. Have you been able to do any kind of population health work with surgery and COVID-19 based upon that relationship?
Well, it's not just Scotland. We're a UK college, so we engage with NHS England as well as NHS Scotland. So it's all exactly the same to the college.
Sure.
Yeah, I mean, we've been involved in the COVID surge work. We've certainly advised and helped both Scottish government and UK government on the whole pandemic. And we advised very early on that there needed to be a pause in all the elective surgery, but that now we have restarted, obviously, and recovery really started in the second phase. But we have made clear that there are issues that we must never allow to happen again, in particular, the pausing of elective surgery, whether it be cancer or benign surgery. It cannot be like this again. And we have raised the issue of that, of course, the American model of having elective centers and ring-fenced, if you like, cold areas rather than the hot and heavy and acute units that we are used to in the UK. You know very well, Steve, that many of the major trusts in England and the health boards in Scotland are very hot and heavy hospitals where all the emergencies come into, and you work side by side with your emergency work and your cold work. That cannot happen again because it resulted in the pausing of all elective surgery in the first wave. That cannot happen. We cannot pause like that again because we will see the aftermath of that and the outcomes of that pausing for years to come, because all of the diagnostic tests were paused as well. Yeah. And we still have many thousands of patients who are waiting for diagnostic tests, not just their treatment, but diagnostic tests. So there's an unknown number of patients who have yet to be diagnosed with cancer. And so the delay is significant. And we over the next 5 years, we will see what that means. But there's going to be certainly calculated in the sort of the 10,000 sort of number of patients who will die early because of delay in diagnosis of cancer as a result of the COVID pandemic. Yeah.
Frightening statistic, which we have heard from other parts of the world as well. We have data in this country that are being accrued by the American Cancer Society and the cancer programs at the American College of Surgeons showing huge delays and more advanced tumors being presented. Well, before we wrap up, thanks again for your time. Any additional parting words you'd like to share with us?
Just to say hello to all our friends in America, and it's lovely to talk to you. I really look forward to coming to Washington, but that is looking unlikely at the moment. But but we will watch and wait and see how things develop. But apart from that, when you can, come and visit us at the Royal College of Surgeons of Edinburgh, and come to the oldest college and the biggest Royal College, and visit us, because it's absolutely beautiful. It's beautiful here now. I came through awful storms on the drive up from Northumberland, but it's absolutely beautiful now. And you know what Arthur's Seat's like, and the gorse is out, and it looks absolutely gorgeous.
Well, fantastic. And I encourage people to take that opportunity. It's a beautiful venue and a rich history and certainly a world acclaimed college. So thanks again, Mike. And I hope we get to see each other soon, one of these days in the not too distant future. In the meantime, stay safe.
And you take care. Bye.
Cheers.